Deputy Captain Connolly.
And I welcome the opportunity, and I often complain there isn't debate, but we certainly got time today in relation to this bill. However, I deplore the fact that it only became available to TDs late on Tuesday night. We had yesterday, and it's up for discussion. I couldn't possibly get through that bill and analyse it in the manner that it deserves, so that's unacceptable. It should have been teased out at committee. I'm probably one of the few that do not welcome this bill, I have to tell you. And I always preface my comments by saying it is a very serious virus with variants which were eminently foreseeable from the very start. And I gave my permission to draconian legislation, and I use every opportunity, because sometimes I've only 2 or 3 minutes. On this occasion, I've longer, to say I gave and I agreed with you reluctantly, because we were facing a serious threat. On the basis of a social contract, or on the basis of a contract of information with you, that you would come back on a regular basis proactively. In relation to, and that never happened. We have reacted and reacted and reacted. So just to put this in perspective for me on what I've read of it, if I look at, I look at the human rights aspect of this. And let me just put it in perspective from the Irish Council for Civil Liberties. And of course, mandatory hotel quarantine was introduced on the 26th of March and came to an end then in April, I think about the 25th of April. So the human rights issues involved, because people have overwhelmingly welcomed this, and I understand that. But what I don't understand is the failure to put it in context and the constant encroachment of human rights without any analysis or assessment whatsoever. Mandatory hotel quarantine undoubtedly amounts to a form of state detention. Persons who travel into Ireland from designated states, and this has gone back, must pay a booking charge in setting out, and so on. But the main point is, it is a form of state detention. And if you deprive somebody of their liberty, we have law and judicial pronouncements going back a very long time. But if we take number 2, in the context of a mental health tribunal, the footnote in relation to justice done in the Supreme Court in 2019, it has always been a hallmark of a constitutional democracy such as ours that the deprivation of the liberty of an individual is not to be lightly undertaken. So when we do that, it must be a last resort and proportionate, because other ways have failed. Ireland has a strong constitutional protection of individual liberty. The detention of persons by the state must adhere to very strict rules in order not to fall foul of these protections. In its current form, and that's going back, in its current form, the mandatory hotel quarantine fails to meet these standards and encroaches unnecessarily on the right to liberty. The present system has significant deficiencies which call into question the ongoing legality of the system as a whole, and the necessity and the proportionality of the detention of certain category of persons. And the Irish Council for Civil Liberties, in that document dated April 2021, goes on to talk about the inadequate appeal system. It fails to meet essential standards for an effective review of detention. The ICCL is concerned at reports of conditions and the behaviour of staff in mandatory hotel quarantine and the failure to put in place an independent inspection system. And for all these reasons, the Irish Council for Civil Liberty believes the present mandatory hotel quarantine is not acceptable with the Constitution and with Ireland's human rights obligations. No, I don't think they're a way out radical organisation. I think they were very moderate in their statement, and that was April. And so some changes were made, not enough in my opinion, and then it relapsed in September, and rightly so. And coming forward now in an anticipatory, to be ready in case the situation gets worse, and I understand that. But what I don't understand is I have no analysis before me of what your department has carried out in relation to the mandatory hotel quarantine to date. We know from some of your content of your speech today, and also from a question asked by my colleague Thomas Pringle and other TDs indeed, that at its peak, 8 hotels were in use, and the busiest day was the 9th of May 2021, when 1,008 persons were in accommodation. In total, 10,398 people entered mandatory hotel quarantine accommodation. We know from today how many tests were done, and you said that 17,846 tests took place on residents, and of those 10,398, 593 residents only tested positive. And I understand then when you go on to say that's not taken into account how the community was saved from transmission by that. But that's an extraordinary figure of 10,398 and the number that tested positive. In relation to, I would really love, I know you have 5 minutes at the end, but I'd really love you to answer why a human rights assessment hasn't been done. I realise we're back now in a crisis situation with figures very high in Ireland again for the last few weeks. And I'll come back to the new variant from South Africa, which has led to the impetus to this. But there have been many months where a human rights assessment should have been carried out so that we could learn. Now, I realise that a review capacity was carried out. No costs have come forward. I realise you're looking at the costs, but we still don't know the costs of the last 6 months of hotel quarantine. And in relation to appeals, we have no idea of why some appeals succeeded and others didn't. We have no idea, was it consistent? We have no idea what themes emerged in terms of the appeal issues or anything like that, so that we can learn from it. And of course, we know going back that it was very inconsistent. And for instance, again, the Irish Council for Civil Liberties point out, it is not clear that the appeals process is effectively or consistently applying the criteria contained within the Act. For example, a man who flew in from Israel to be with his dying father, who was in intensive care and was expected to pass shortly, was denied 2 appeals for an exemption on humanitarian grounds 6. It is difficult to imagine what could constitute a humanitarian appeal if being with one's dying parent did not. Now, I realise that that was dealt with, Minister, and I'm not asking you to go back into the details of this when you have your 5 minutes. That's over, and various appeals were made subsequently to the 2 appeals that failed. What I'm asking you is, what have we learned? What mechanisms have been put in place? How have we improved the appeals mechanism so that this situation does not arise again? And I'm really disappointed that that type of information is not before us, because from day one, and when I agreed to the draconian legislation, I did so with knowledge that what I was agreeing to was draconian, the most severe encroachment on our basic human rights. And I did so because of a threat. Almost 2 years down the road, I expect a completely different approach from the government in relation to legislation, proportionality, analysis. And all of the time that I stand here, whether it's 20 minutes or 2 minutes, I'm conscious of Galway. And I'm conscious, and I use it as an example always. In Connemara, I know 2 people who are now well into their 70s who cannot get home care. Why is that? because there's no home care available. The private company is not providing it. The health executive relied on the private company. It's not there. There are issues with the pandemic. I understand those practical issues. What I don't understand is the failure to come proactively before the Dáil and say, this is the situation on the ground. We haven't opened our respite centres. We haven't opened our day centres, and we have huge difficulties with no home care, and an analysis of that. Now, I have my own views on that. I saw this happening because I sat on a health forum for 10 years of my life, every 2 months, and rarely missed a meeting. And I saw them dismantling of our health system and the privatisation of it on every level and the commodification of it. So sometimes I'm utterly filled with frustration when I listen to the level of the debate from all sides in relation to the health system, when this was an absolute policy by various governments, but particularly by Fianna Fáil and the PDs at the time, to privatise the health service and break it down. And in my time, I've repeated, back in 2006, language was used like the beds are being refurbished. I mean, I heard of houses being refurbished, but the new language started to creep in. So back to the present day and back to the topic that we're looking at, I make my comments all of the time in the context of a crisis being used to further encroach on human rights without any analysis, and the easy acceptance by a lot of TDs that this is happening. And so the latest one comes from I can't pronounce it myself, the Omicron. The Omicron, and I'm sure the Minister won't take this very well, but if you actually look at that, the word is moronic, if you take it in terms of, I forget the word for it in my tiredness. It was 2 o'clock this morning, I think, when we got to bed. But if we look at that as a word to make out what the word is, it's actually moronic. And moronic, I looked up, I didn't want to insult anybody. So it means idiotic, stupid. And to me, that is what has characterised the government's approach, generally, not just you, Minister, generally to the COVID pandemic crisis over the last 2 years. We had a situation a few weeks ago where we were talking about nightclubs, and we had images of young people and older people on the street, no social distancing, and our time consumed with whether nightclubs should open or not and whether people should wear masks inside, when all of the time I knew that day centres weren't open, respite centres weren't open, and people are at home without care. No analysis of that, and the government's time taken up whether we can go in or out of nightclubs. No analysis in relation to ventilation, although many, including Rushing Shortall this morning, and lots of other TDs have raised it repeatedly. It's always wash your hands, which I do, which we all do to the point of damage, really, at this stage. But we do it because that's the right thing to do, but absolutely no mention of ventilation at all in any of the announcements. So when we come back to this legislation, as I said, it was published on Tuesday. I got to look at it today and while I was sitting in the chair on occasions. And it'll be guillotined today and passed through, even though there's no emergency today. The library managed to produce, under pressure, a briefing paper. And again, once again, for the, I don't know, many times, I want to thank them for their work. And we're putting them in a position where they say the LNRS is not publishing a bill digest on the bill because of the time frame between the publication of the bill on the 1st of December and the second stage on the 2nd of December. Now, you're bringing this in so that you'll be able to act in the future, and yet no problem, no time to analyse, to reflect or to discuss. I welcome, there were one or good points in it, and I welcome that, where the Minister will have a mechanism for a person to leave mandatory hotel quarantine. And I also welcome the pre-application and the clarifying of that. What I do not welcome is that you will have more power. You will be able to bring in in writing what you decide is right without any discussion in the Dáil. And forgive me if I'm flicking papers, but that's the nature of the way we've led into this debate. So you will be able to designate in writing and make certain orders under this Act. Again, regulations have been published in the past, way after the event. We've been left as TDs with no information, having staff scramble through to see what regulations and to try and understand what they are. And we're doing that all over again. I see no provision for hardship cases in this. This is a very costly business. I see nothing in here about hardship cases, and this was raised many times. The constant confusion and obfuscation in relation to the PCR testing and antigen testing is just simply unacceptable. And the 3 days with the PCR and the 2 days the other way, 2 days with the antigen, and as has been mentioned already, and I heard that interview, the assistant professor from UCD on having huge difficulty understanding the science behind this, and this is a virologist, and we're told all of the time to respect the scientific advice, and here's this man, academic, telling us he has great difficulty understanding it. And so that brings me back that each and every one of us have to try and read and listen and then come to our own conclusions and make our decisions as best we can in the knowledge that we must protect ourselves and each other. But we do that. Instead of that type of debate, what we have is a demonization of people who, for many reasons, and they're certainly not a homogenous group, decide not to be vaccinated for one reason or another. We have unacceptably gone down the road of them and us, or us and them. And now we are looking at children with an announcement that they must wear masks. Now, whether that's right or wrong, I have the greatest difficulty. I am actually delighted, Minister, delight is not the word, that my sons are older and I don't have to make those decisions now for them, because the flippant way that we're referring to it'll do them no harm is simply appalling. It's unacceptable to me, and it is just so wrong that these decisions are coming across, are being done in the manner that they're being done. There were one other 2 points I've made. Tiredness has got to me, actually, from the night before, and I only use that as an example. Tiredness, I would say, has got to all the TDs, given what has been done with the Clár Oibre for the Dáil and the amount of items put in, and the late sitting and the early sitting this morning. It is difficult to deal with this, but I want to use my voice to say I am unhappy with the continued encroachment on our human rights without any analysis, without the government framing the debate within that, and an acknowledgement that when we do that, it must be temporary, it must be proportionate, and it must be, when it's discriminatory, it must be based on fact and targeted and for a small piece of time. Going back to the latest virus and the word moronic, we have designated South Africa and we have punished South Africa for being good and for analysing the virus and sharing that knowledge with us, rather than embracing them. And now we know that that virus is in Ireland and other countries, and not necessarily from South Africa or any country at all. And yet we've gone down again the demonisation route, might be too strong a word, but certainly the punishment route in relation to our approach to dealing with COVID. For all those reasons, I will not be supporting this legislation.